Hello and welcome, everyone. Thank you so much for joining our monthly Hunger, Nutrition, and Health Action Collaborative webinar. I'm Rachel Forensic with the CDC Foundation. Wanted to make sure you know that the Zoom chat is open, so you should feel free to introduce yourself and your organization. During the panel, we will turn that off, and we will then open it up when we're done with that. You've asked, please feel free to put in resources and information that you might think is of interest to others. We also want to give you a friendly reminder to please be kind. Also, don't post any political commentary, please, or sell any products. At any time during the webinar, you can submit questions for the panel using the Q&A feature. Now we are going to launch our one and only poll, which we do every time, where we want to find out what kind of organizations are joining us on today's call. So Lexi, if you'll launch that, thank you. We'll give it, I don't know, about 20 seconds. Okay, Lexi, we can probably close the poll. Awesome. Wow, we have a good representation across, we have a lot of local government agency today, and a good representation across a lot of different organizations. So I'm glad to see that. Thanks so much. All right, let's dive in. Both of the organizations joining us today work at the intersection of food, education, and community health by empowering individuals with practical culinary skills, nutrition knowledge, and broader life skills through evidence-based and hands-on programs. Teaching kitchens are dynamic, hands-on learning environments where people gain essential life skills. They offer engaging, practical experiences that empower participants with healthy cooking techniques and nutrition. In both physical and virtual teaching kitchens, people of all backgrounds come together to learn and practice skills that enhance daily life and promote long-term health. Founded in 2016 by leaders from the Harvard T.H. Chan School of Public Health, Department of Nutrition, and the Culinary Institute of America, the Teaching Kitchen Collaborative was formed to unite early advocates of teaching kitchens as a public health intervention. For more than 30 years, the Brotherhood Sister Sol, also known as BroSis, has been at the forefront of social justice, educating, organizing, and training to challenge inequity and champion opportunity for all. With a focus on Black and Latinx youth, BroSis is where young people claim the power of their history, identity, and community to build the future they want to see. And they are located in Harlem, New York City. Okay, today I have with me Rebecka Jerome, Executive Chef at the Brotherhood Sister Sol, and Katie Welch, Executive Director of the Teaching Kitchen Collaborative. Welcome, Rebecka and Katie. I'm so glad to have you here for this great conversation. So let's go ahead and dive in. Rebecka, I would love to start with you and ask you, what makes Brotherhood Sister Sol different from what people might typically think of as after school and youth programming? And how does health fit into your mission?
So we are not just an after-school program, but we are a social justice youth development organization. One of our missions is to make sure that all of our members are provided with a healthy meal, and any youth who come into the building are provided with a healthy meal. Alongside that, we do culinary, we do teaching. And the thinking behind that, part of the thinking behind that is that as a social justice organization, we look at food as also a social justice issue. And the first thing we think about is that is food empowerment. And one of the ways to get empowerment through food is actually being able to prepare it. So our program actually is split into 3 sections according to age. So we have an elementary program, a middle school program, and a high school program. And what we try to do is first instill a love for cooking, which most kids love today. I mean, food is just such an in thing. If another kid tells me about something they've seen on TikTok, I'm going to go crazy. But so we have kids as young as 8 who come in and actually want to cook. We start them out with teaching about fruits and vegetables, and we don't want to be pedantic about it because we lose them right away. So we have a course that is cooking the rainbow, and so we have young kids who are it's all fruit and vegetables, and we discuss colors of fruit and vegetables, and they learn to cut and chop and cook and like the food. I mean, kids make the food, and things that they thought they didn't like, they suddenly start liking. Then we do a program for middle school. We focus a lot more on culturally relevant foods for them. There's often shame tied to some of the foods that most of our members grow up eating. It's often called unhealthy. It's not good for you. And there's not a lot of truth in that. And we want to instill a sense of pride and to honor other our members' culture. So we do sort of international cooking, but we bring in foods that they eat at home or that maybe their grandmothers make or that they want to try. And with our older children, we start working more consciously on life skills. So everything about Brosis is intentional, and this fits into our model. And so it's learning how to cook. This year, for the first time, we're actually doing a training program where we're training our high school students how to take the New York State Food Handlers license. And we also, because we have a farmers market, it's a community-based farmers market. We're going to be baking and selling products that our members make in the farmers market. They also have started this year helping us prep for the food that we serve, which I thought would be met with a lot of pushback, but they actually love it. They feel very empowered by that they're making food for their friends or, their peers. And it sometimes means they're chopping, I don't know, 50 pounds of onions, but they seem they're fine with it. So anyway, so I
Oh,
think
that's
that's the intentionality, the social justice part is, I think, what sets us apart from many other sort of youth organizations.
wonderful. I love how you talked about food as empowerment and being able to cook your own food and um, how empowering that is. So thank you for that. So much great, cool stuff you all are doing there. Katie, Teaching Kitchen Collaborative has member organizations across the US. What are some of the differences and similarities in the ways that communities are using culinary education to address health and resiliency?
Yeah, thanks for that question, Rachel. And I will just say that the Teaching Kitchen Collaborative is a global organization. We have members all over the world, but primarily here in the United States. And across the US, whether the teaching kitchens are in a school-based setting, a university, a healthcare organization, within a community-based organization, these teaching kitchens are being leveraged to strengthen health and resilience by teaching individuals not only what to eat, but how to prepare these sort of nourishing and culturally relevant meals. I would say that the really common threads across teaching kitchens include partnerships across healthcare, schools, community-based organizations, this idea of hands-on behavior-based learning, and a focus on access and cultural authenticity. For each community, wherever that teaching kitchen is located, we believe that the sort of provider or leader of that program really can do the best job of taking basic nutrition information and culinary skills and translating that into a way that's culturally relevant for their population. But I will say also that programs really differ based on the local context, whether they're in an urban or rural setting, based on resources that are available to that teaching kitchen program, the cultural identity, and then the primary goals, whether that's chronic disease prevention or treatment, or education for medical professionals. So it really differs in sort of what the end goals are of the teaching kitchen programs.
Fantastic. Katie, let's continue on for a second. What key challenges or gaps in education and community nutrition do teaching kitchens and after-school meals uniquely address?
Yeah, I would say that for the vast majority of people coming into teaching kitchens that belong to our collaborative, what we're seeing is just a lack of culinary and nutrition information being passed down from generation to generation. It's also not being taught anymore in home ec, if we're talking broadly across the board. So that's a real lack of education and fundamental education for our young residents and citizens of the U.S. And so they have a loss of, those skills, a loss of nutrition information, a loss of cultural nutrition information that's relevant. I would say for medical professionals, there's a lot of talk right now about the lack of nutrition education. It's just not mandated right now that medical professionals have any nutrition training as part of their medical training. And so that's something that we're working on. RDs, or registered dietitians, are experts in diet and nutrition, but many of them do not have hands-on culinary experience or may not have hands-on culinary experience. And then we have a lot of chefs in our community who are experts, obviously, in creating delicious recipes and in recipe development, but they may not have any background in nutrition and health. So I'd say that the gaps that we're seeing are really in skills, basic culinary skills, nutrition education, and then confidence in the kitchen. And what we really want to try to do and what our members are working on is making healthy eating both possible and really meaningful, which is transforming food from a source of inequity into a tool for learning, connection, and lifelong well-being.
Fantastic. You made me, both of you had me thinking as well about, is there a best age to start people cooking, like where they're most receptive to learning this? Any opinions you have?
I would say there's not, I have not experienced it. There's a best age. I think there's a different type of openness depending on the age. So the younger kids are like sponges and they're super excited. And even the idea that they get to hold a knife is like a wow factor to them. I find the middle school kids, there's a lot of sort of judgment. Oh, I don't want to eat that. I don't like that. And that sort of stops them a little bit. They will do it, especially if they're engaged and they're in a learning environment, they will do it. And and the same probably goes with high school. They're a little more interested, I mean, they're getting older, they're wanting to cook more at home. Some of them are thinking about what they're going to be cooking when they go away to school or when they finish high school.
Mhm.
But I would not say that there's one age that's better. I think I have found that the kids who are in our kitchen just want to be there and learn.
Yeah, I would agree
Fantastic.
with that, Rebecca. Like, no age is too young,
Yeah,
to sort
yeah,
of like get them started in that experimentation of, like you said, like eating the rainbow, right? How do we eat foods and fruits and veggies that are all kinds of colors that provide all kinds of like different nutrients and phytonutrients for our bodies and for our health? We're discussing internally, like, is there some way for us to look at, folks who do this for a living? Did they learn to chop vegetables with their grandmother at a very young age? Like, what was that sort of early ignition of the passion and the drive to pursue a career in food, or food is medicine, culinary medicine? So I think that there's no age that's too young, but the younger the better. We believe in sort of that early exposure to foods that you may not recognize or be familiar with that are so essential to health and well-being.
That's fantastic. Thank you both. This webinar is really focused, all our series is focused on partnerships and cultivating partnerships. So I wanted to ask you both, are there any innovative partnership models that you are aware of, either through all your members or that you've seen, Rebecca, in your work? Partnership models, something like maybe co-location in community centers. I think I recently read about a teaching kitchen that was put into a library and pulling in patrons that way. that improve accessibility and sustainability of these models? So that's really a question for both of you. Either of you want to start that?
I would just say that we don't really have any partnership models within the teaching kitchen. I mean, we are open to the community, and we do community classes for parents and other people in the community, usually around healthy cooking or things that have grown in our garden. And the Brotherhood Sister Sol does lots and lots of partnerships, and we think of our organization as almost sort of a public health model. So we have collaborate with Grow New York City, which is a New York City funded produce distribution center, and they get lots of produce from local farms. And we use that for our farmers market, where we also a third of our food that's purchased at the farmers market is used with health bucks. I don't know if you're familiar with that, but that is if you use SNAP or EBT, for every $2 you get $2 in health bucks. So we sort of collaborate with the with the government there. Also during COVID, we had a meal distribution program where we distributed over 1 million meals to families, to members and community members. And there we collaborated with Corbin Farm as well as New York City Grow. At Thanksgiving, we do a Thanksgiving grocery distribution where we actually work with various corporations as service funders and through donations. But um, those are just some of the
Great.
areas that are food related, but actually within the teaching kitchen, we have not really done that yet.
Thanks.
Great. Katie, go ahead, please. Sorry.
No worries. I think that the sort of idea of co-locating a teaching kitchen in a location where people already gather is such a brilliant way to, take advantage of the sort of cross-pollination that can happen. I'll give a couple of examples. Our friends down at University of Texas are doing a great program where they partner with houses of worship in rural areas to bring in those communities and to lower the barrier to entry of a teaching kitchen, right? Is a teaching kitchen a multi-million-dollar built-in space? It doesn't have to be. Can it be a pop-up or a virtual, or can you use a space that already exists? This idea of partnering with, communities where they are already gathering for a service, or they already have a kitchen where they're making, meals for their community. That's a great way for teaching kitchen programs to sort of like get started. Again, it's a low barrier to entry. And that's one example that we've seen. Recently, the Cincinnati Museum Center reopened their beautiful new building in Cincinnati with a huge teaching kitchen inside of that museum. So this idea that teaching kitchens can be in museums and in libraries and in houses of worship and really in medical centers. Boston Medical Center is another, location where they have a huge and beautiful teaching kitchen that is, training patients how to eat better and to support their own health and well-being. Again, using a shared use space reduces overhead, fosters cross-sector collaboration, and I think also creates more sustainable ecosystems where that kind of education, nourishment, community, and wellness can all reinforce one another. And so I think that coming together around food, like all of us do, right? The party in my house is always in the kitchen, right? So this idea of people gathering in one space where there is health and wellness and community and collective learning, it's really powerful as a model and something that we really encourage folks to do when they contact us about doing it.
That's fantastic. Katie, I'm going to ask you to look into your crystal ball. And just tell us how you think national policy or philanthropic trends might shape the collaborative approaches over the next few years in this space.
Yeah, thanks. I think that, since the Teaching Kitchen Collaborative's inception about 10 years ago, we're seeing for the first time, national priorities around, emphasizing food as medicine, both in patient care and in medical education. And that's really exciting for us and for our members when we think about how we can help contribute to both of those areas. And I think that the healthcare community integration is also creating fertile ground for expansion of existing teaching kitchens and the development of new collaborations around teaching kitchens and food as medicine. I will say that philanthropic investment is already accelerating the development of teaching kitchens and other food as medicine models that unite education, public health, and equity. And overall, I would say that between that national policy, as you said, and for private philanthropy, teaching kitchens are really being positioned as a scalable, evidence-based strategy that can help to transform population health through food and through one meal at a time.
Great. We're going to transition over to some questions from our audience. So just a reminder that if you have questions, so please put those in the Q&A. Rebecka, I want to start with you. How do you recruit the participants in your program? And how long are kids typically participating in the programs that you do in the kitchen, or even others beyond the kitchen?
So, Brotherhood Sister Sol has a very active recruitment, actively recruits in local schools. And so we go into schools and work with students there, and kids come into the building. And then a lot of it is word of mouth, and it's a neighborhood, and people hear about it through their friends or through their schools, or their parent coordinators might tell their students about it, and so they join the program. We have a much larger summer program as well, which is there's a lot of active recruitment for that, and some of those kids stay on. And the culinary teaching is all voluntary. Our middle school kids have to do a certain 2 or 3 classes to be in the Brotherhood Sister Sol, so some of them choose culinary. For the elementary school kids, it's part of their program. Once a week there's culinary. But it's actually very popular, so we don't really have a hard time getting them to join. And was there a second part to that question? No, I can't remember. Oh, yes, so we start at in elementary school. Some kids start as early as 8 years old and go up to 18. We have kids who are in the program from the age of 8 to 18. And we also have, as we discussed earlier, we have many staff members who went through the program. So they're allowed to stay as long as they want. I now have kids in high school who I had a few years ago, and kids in the elementary who are now in the middle school program. So it just continues.
Yeah, that's great. Just building on that for a second, and another question was about your culinary instructors. Do you get any of those from the community? Someone asked, how about grandparents?
It's funny.
Do they
Yeah.
ever come in?
Yeah, that's a great question, because we actually, it's our staff that does it, but we discussed this year of having a program where we have guest chefs, whether they're chefs in professional kitchens, and grandparents or parents who would come in and particularly do foods that we might not do, or foods that they do from their own countries or at home. And so that's something that we're actually working on for this year, meaning this school year.
Yeah, that's great. Can't wait to hear how those go. Katie, someone asked specifically if there are kitchens in New Hampshire, but I'm sure people are curious about them all over the country. So I would just say, just tell the audience a little bit about how they do find out about teaching kitchens in their state or community. Where would they go to learn that information?
Yeah, great question. I wrote in the chat here, this is a link to the list of all of our members.
Fantastic.
So again, we have over 70 organization and corporate members, and they're all listed here. And you can search, there's a search bar up at the top. You can search by location or state or whatever it is that you're looking for. And then they're also all linked to learn more about each of these individual teaching kitchens.
Fantastic. For a question for either of you is around funding for facilities and or equipment. Can you say anything about where are some of the sources of that funding, where that might come from? from either of you,
Yeah,
your
I'm
experience?
happy to start. So, what we like to say and also kind of laugh about a little bit is when you've seen one teaching kitchen, you've seen one teaching kitchen, right? They're all so unique and different in how they're funded and how they operate. I will say that a lot of teaching kitchens at this point who are part of our membership do have philanthropic funding as part of their revenue streams. There can also be earned revenue from teaching kitchens. A lot of our teaching kitchens work, operate their programs during the day. They can rent out their space for different sort of opportunities for revenue generation. There can be state and federal contracts. There can be shared medical appointments. Shared medical appointments is something that a lot of our members are exploring right now, which is essentially a way to have reimbursable teaching kitchen classes for patients. Universities are investing in teaching kitchen courses for their students because they see it as a increasingly important part of nutrition or of medical education. So I will say it's very diverse in terms of the funding streams. Google is a member. They're self-funded, one might say. So it really spans the gamut in terms of how the kitchens are funded, but the vast majority of our members do have multiple revenue streams that they're sort of braiding together to support their programs in their entirety.
Great. Another question has to do with, sadly, the ending of SNAP Ed. And wondering if you see teaching kitchens as a potential way to maybe help fill a gap that might lead. If you have any thoughts about that.
Rebecka, did you want to go?
I mean, I would just say that I think teaching kitchens provide culinary training, and the more that you know about how to process food, the better you are when that money is not there. I mean, whether it's being able to take a pot of beans and make it tasty, or how to stretch something in a healthy way. I mean, that's what hopefully we are going to have to be able to achieve a lot of this. Unfortunately, we're going to have to be able to achieve a lot of that this year or right now.
Yeah, I will just add to that I think, with the cuts and SNAP ads, so many of our members have been impacted by that and are trying to figure out sort of what is the sort of right and best path forward. But I think especially with the loss of SNAP, teaching kitchens become almost like critical infrastructure for helping families and individuals to navigate how do they make healthy, nutritious meals that are also delicious and sustainable for their families.
Fantastic. Ladies, it is 2 minutes until the top of the hour. This time went super fast. It usually does, but it really went by fast today, listening to you all. It was so wonderful to hear both the on the ground, what is happening in a kitchen, in after school, in programming that you provided, Rebecka, all the really great stuff that's happening there. And then Katie, your perspective about teaching kitchens more broadly and how people can learn more about them across the country and across the globe. So once again, thank you both so much for being here. It was really a pleasure to learn more about this. And I feel like I have no doubt that there's going to be more and more of this in the years to come. So thank you both very much. I would love to remind folks that our next webinar will be on November 19th at the same time, 3:30 Eastern. So please save the date, and you can also register at impacthunger.org. A survey will pop up at the end of this meeting, and we really appreciate you all taking just a couple minutes to fill that out. Tell us about your experience today. And also, if you are so inclined to tell us in the chat right now, is there anything that you might do differently or something new that you might do given what you learned today? We'd love to hear about that as well and can pass that on to our participants. So again, Katie and Rebecka, thank you so much for your time. Thank you to our audience for the great questions, keeping this going and lively. And thank you so much for being here today, and hope everyone has a great rest of the day.
Thank you so much. Thanks, Rachel. Thanks, Rebecca.
Thank
Thanks,
you.
Katie.
You take care. Bye-bye.
Take care. Bye-bye.